Journey to becoming a certified diabetic educator as a registered nurse. What area of nursing am I interested in pursuing? I am interested in pursuing becoming a registered nurse that is a certified diabetic educator. The reason why I am passionate about this cause is because it affects someone that I dearly love. It affects my husband. He was diagnosed with type 1 diabetes the day before he turned 18. Seeing him go through the struggles that he's gone through and having to get accustomed to doing his medications and help him with his diet and different aspects of it has made me realize the importance of this. One area that really touched me was when my husband was in his motorcycle accident in 2005. It was really hard to keep his blood glucose under tight control, and he had major highs and major lows, and it was just really hard for him to stay in control. Seeing the nurses struggle with this, with keeping it in control, and then the endocrinologist being brought in and the diabetic nurse educator that was brought in, seeing their compassion and how much they really want their clients or patients to be successful in managing their disease and being able to live a productive and fulfilling life made it a true impact on me, and that's why I really want to pursue this. What exactly is a registered nurse, certified diabetic educator, or a diabetic educator in general? It is a healthcare professional or a health professional that is used to the disease process of what diabetes is, how to pre-diabetes, and how to educate someone or to go about living with the disease, and what all aspects that the life of the person that has this is going to be affected, so that way they can incorporate in different aspects of their education. A certified diabetic educator plays a role with not only education, but in regards to the medication, but in regards also to their lifestyle, the steps they need to do to prevent wounds on their feet, and also teaching them that wounds in general will heal slower than normal. With this aspect in mind, it's important for someone to truly understand the disease process and how major highs in blood sugar can slow it down, or major lows can limit the healing process. Also, a person with diabetes needs to be educated on what kind of foods are going to be helpful to manage and keep their blood glucose more stable, as in proteins. And this in general helps the client to be able to become more able to care for themselves and make knowledgeable choices that will help with the disease process. According to the CDC in 2014, 18,436 children under the age of 20 were newly diagnosed in between the years of 2008 and 2009 with type 1 diabetes. And these children, while they're in the hospital, with the shortage of nurses that all healthcare industries are facing, it makes it hard for the nurses to be able to actually provide the education that the patients need. That's where a role of a certified diabetic educator can help fill the downfall in that area. Additionally, each year it's estimated that 25.8 million people in the United States are living with diabetes, and another 79 million are estimated to have pre-diabetes. With these numbers, it's very easy to see that somebody that is in the healthcare profession is going to know somebody firsthand, whether it be a family member or a friend, that is touched by this disease in some fashion, whether they have it or are in the pre-diabetes stage. It is important for this reason for us to be able to know how to educate the patients and their caregivers on what the steps are to help manage this disease. One of the interesting things that I found out while I was researching this is that it's easier for someone to be able to relate to someone else that has a first-hand knowledge, whether it be themselves or with caring for a loved one that has undergone or is currently going through this disease, and can relate their own personal stories to their patients and can make it a first-hand understanding for the patient and try to make it more lifelike and make them understand that this is a serious illness that needs to be addressed and taken care of, or it can cause major complications. Another thing that I found interesting was that there are communities, especially in Chicago, with the article that I found by West, that the underprivileged in some of the communities have a harder time of being able to get access to medications, proper foods that will help with the treatment and managing of the disease. And I just think in general that with more people being exposed to a certified diabetic educator and having access to being educated by one, that it's going to help hopefully to reduce the downfall of not having these supplies and foods. If we can educate our patients on what kind of foods would be good and they can possibly grow it in their own backyard or in a little garden box with fresh vegetables and healthy fruits, it could definitely help these patients. So that's another aspect that I could see definitely helping. Part of what I found in my study was different aspects where not only are patients exposed to different aspects of the disease, but the educator needs to be able to have knowledge on the different supplies that they might need. Meaning, some people might prefer a pump, and if they're on insulin, the insulin pump makes it easier to manage the disease because it can communicate with your glucometer about what your current blood sugar is, and makes it easier for the patient to get the insulin without having to inject a needle every time they need to administer insulin. This is a picture of a possible insulin pump. This is a glucometer that can be used to check the blood sugar. This is an insulin pen that can be used, and then the lancets to test the blood sugar that would be used with the insulin or the blood glucometer, and then some of the insulin syringes that could be used. Additionally, this is a diabetic wound on a foot that a certified diabetic educator should be able to help educate the patient on how to prevent, what signs to look for, and what all treatment needs to be done if they do get this, and that they need to seek medical attention when they get this so it can be stopped and reversed as quickly as possible so it heals properly. And this is part of why I feel that becoming a certified diabetic educator is my passion. Thank you.